بسم الله الحمد لله والصلاة والسلام على رسول الله رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي السلام عليكم. Inshallah, I hope everybody is good. I wanted to do a brief video today on common types of medications that we use in mental health because I have received multiple questions about medications. As I mentioned in my previous videos, medication is only one um, treatment modality that we use in mental health, including also obviously psychosocial interventions. So in terms of medications, the commonest medications we prescribe as psychiatrists in mental health are antidepressants and antipsychotics, broadly speaking. So if we start off by talking about antidepressants, there are many different types of antidepressants, but essentially what is thought to be the issue, one of the issues in depression in terms of neurobiology is a lack of serotonin. So the vast majority of medications used for treating depression are called SSRIs, selective serotonin reuptake inhibitors. And in that group, commonly you would have heard of Prozac or fluoxetine, sertraline is another one, paroxetine, uh, citalopram, escitalopram, these kind of medications. There are also the pharmacological uh, antidepressants like mirtazapine, which work slightly differently, working on noradrenaline. But essentially, the SSRIs are the commonest, and they are very effective. In terms of starting treatment, it depends on the severity of depression. So broadly speaking, we define it or divide it into mild, moderate, and severe based on the level of impairment individuals have in terms of work life, family life. Um, and so moderate to severe depressive episodes are usually treated with medication. And they are very effective. The issue with antidepressants, for those of you who have tried them or who have been on them, is that it can take 4 to 6 weeks before you notice an improvement in your depressive symptoms. So a lot of patients, unfortunately, they stop taking it um, before we can really assess the effectiveness of the medication. Common side effects you experience include nausea, vomiting, maybe some abdominal pain, and there's a very small risk of suicidal thoughts, which I've never seen in any of my patients I've treated, but it is in the literature. So that's something that we warn patients about, that if they do experience dark thoughts about wanting to hurt themselves, they need to inform their psychiatrist. Uh, yeah, and in terms of how long people have to take the medication for, like I've mentioned in my earlier videos, it's really important that we intervene early intervention. So for a first depressive episode, the guidance is that patients should be on antidepressants for at least 6 months after recovery. So that could be up to about a year from starting medication. And for patients who have recurrent depressive episodes or other types of comorbidities like anxiety, maybe they have bipolar, they may need to take it for a number of years. Okay, and in terms of the other type of medication, antipsychotics, these are used to treat psychotic episodes like schizophrenia, like drug-induced psychosis, like psychotic depression, like postpartum, i.e. after delivery, some females may experience psychotic symptoms. Um, and the commonest types you probably have heard of is olanzapine, quetiapine, risperidone. These are common antipsychotics. And we have both options of oral and injectable. So usually we start off with oral antipsychotics. And if patients have difficulty being compliant with their treatment regime, then we can switch them to um, long-acting injectables or what are called depot medications, which can be weekly, once a week, or once a month. And antipsychotics, if you break it down, basically work on the dopamine system. So it's thought that psychotic episodes result from um, too much dopamine. And so these antipsychotics basically block dopamine receptors and treat symptoms like hallucinations and delusions and paranoia. Again, they are very effective medications. Somebody who has an acute psychotic episode that may require hospitalization may also have what we call rapid trank. So if they become acutely disturbed, they will have injected antipsychotics like haloperidol, like um, olanzapine as well, to treat the acute agitation, but they will be treated long term with antipsychotics. Um, and what we do know is there's a high risk of relapse when patients stop taking antipsychotics. They can have a psychotic relapse. So we work very closely with patients with regards to this. Common side effects, unfortunately, antipsychotics do have a number of side effects, including sedation or and also extrapyramidal side effects, which are things like stiffness and rigidity, maybe drooling. And in severe cases, you can have what's called an oculogyrate crisis, where your eyes basically go into spasm. Longer term, there are risks of what we call metabolic syndrome. So some patients can develop diabetes, obesity as well. Weight gain is a common complaint. And there's something, it can affect the heart, something called QT prolongation. So it can cause arrhythmias. So we monitor these things very closely. You need to have an ECG before you start antipsychotics, and repeat them at regular intervals. Also, we do blood tests because it can cause something called hyperprolactinemia. Um, so these are some of the common kind of side effects. For patients who are treatment resistant, we have something called clozapine. Clozapine is very, very effective, but unfortunately has quite severe side effects, and you need regular monitoring in terms of blood levels. Um, yeah, so that's a very brief summary about medications. I'll signpost you guys to the NICE, the National Institute of Clinical Health Excellence website, where you can get more information, reliable information on medications, and also the Royal College of Psychiatry website, which has really good patient information leaflets. Okay, until next time, this is your brother, Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.